Hi guys, welcome kwenye Malezi Bora. I'm your host Juliet and it's good to see all of you.
Hi guys, karibuni kwenye show. My name is Chep. Mama, wacha nikuulize swali moja. Do you have a thermometer in the house?
Yes.
Msichana job anajua kutumia?
Wacha tuseme na trainingi, by the time ameshika ameenda, so mwenye ako currently hajui.
So yes guys, hiyo inatupeleka kwenye topic of discussion leo. Kwenye practical mom lesson tutakuwa tunaonyeshwa na Dr. Imran wa hapa Gertrude what to do when a baby convulses at home.
Yes. And I'm excited kwa sababu gani CJ experience convulsions and I've had moms talk about it and they always say ni kitu hawezi taka ku-experience tena na ni kitu hawezi taka kuona another mom aki-experience. So I want to know all about it and I believe with Dr. Imran tutasaidia many other moms out there.
True.
Yes.
Today kwenye show we are two students. Tutakuwa tunajifunza what convulsion is and what to do in case a baby convulses. Ndio kabisa.
Leo tuko students. So we go on set ready to learn.
Karibuni kwenye show. Hi guys, karibuni kwenye show. And today kwenye show tutakuwa tunaongelea about convulsion. What is convulsion? Mimi sijui. Today I'm a student in the show. And first things first, tuko Gertrude's Hospital Muthaiga branch. This is their main biggest branch. So if you have a baby, you know, I think Gertrude iko na jina poa hapo nje, so you know where to bring your babies. And with us is Dr. Imran. He's a pediatrician hapa Gertrude's Hospital. And yeye ndiye atakuwa na to take through what convulsion is. He's not seems new kwa show. He's a very familiar face. I think you're almost becoming our resident doctor.
Oh, I appreciate it. Thank you.
But anyway, guys, karibuni kwenye show. And of course with me is my lovely co-host Juliet. Do you feel like introducing yourself?
I'm good and I love today's topic because venye tu umesema pia mimi na feel I'm a student because I've only had moms say about convulsions and the trauma it brings, and yes, I'm ready to learn and looking forward to a great conversation. Yes.
So Dr. Imran, welcome to the show.
Thank you so much for having me.
First things first,
Yes.
what is convulsion?
All right. So let's get down to it. So usually convulsions are an abnormal behavior. Okay. We can agree with that. It's not the normal for a child to start suddenly, because it's something that doesn't take time. It's sudden, and it's an abnormal behavior where you see the child either jerking, having sort of abnormal jerky movements, or stiffening, okay, or even eyes rolling or frothing in the mouth, okay, and that usually comes from an abnormal activity in the brain. Because remember, the brain is the one that controls
the body.
everything. Actually, your breathing, your gut movement, your heart rate, and your respiratory rate. All of that is controlled centrally or primarily by the brain. Now, when the brain's activity suddenly goes out of control, now you start seeing the jerking movements coming out from there. Okay? Yes. So that is what a convulsion is. Okay? Now, remember, convulsions don't come the same in different age groups. In a smaller baby, let's say a newborn who has been born, they can actually you can actually have convulsions starting at a newborn's age. Maybe they've had some distress during delivery, or have not received enough oxygen, or difficult labor, or so a child doesn't get that oxygen in the brain. So brain is affected, right? So when your brain is affected, maybe it could be a small spot in the brain which has some injury. So that is now the way the convulsion begins, because that excitement or stimulation or begins now a wave of activity all around the brain. So as that wave moves around the brain is when now you see, now looking outside, the hands are moving, the eyes are twitching, sometimes you are frothing or the eye rolling, because there's no control. Okay, it's like a computer which is shutting down for a few minutes. Like everything is just blipping and blinking and everything like that, you see. So that is what a convulsion is. Yes.
And what causes convulsion?
Good question. So again, it could be many reasons. We've talked about newborns. Primarily, if the brain is affected because of low oxygen, you can start having convulsions at that age. So, but they may not, like I said, do the whole, stiffening and everything like that. They could just be twitching of the eyes. or just the baby is not with you. You know, you can feel there's something that's not right. So that's that. Now, later on, as the baby is growing up, maybe they didn't have any issues during birth, but everything was normal, and now they are from the age of 6 months up to 6 years, they are at higher tendencies to get convulsions because of fever, what we call febrile convulsions. Okay, yeah. Now these ones are not the typical convulsions that you'd see in epilepsy or So they're usually very short. And after the convulsion, when the child recovers, they're able to sort of, the child is able to come back to normal and talk as if nothing happened, and everything comes back to normal. They're feeding normally, but because of that fever, their brain may have, suddenly reacted badly. Because remember, the temperature control of the thermostat is in the brain. So when temperatures go very high, up to 40 sometimes, the brain goes out of control. All right, but those are very short acting. And remember, not all children will have febrile convulsions. Some will be running at 39 and they're running all over the place. But there are some who are so sensitive that at even 38 or even lower temperatures, they suddenly start fitting. Yes, yes.
Yeah, and Doc, now that we've asked all these questions, Juliet ameshtuka, umeshtuka? Hata mimi nimeshtuka. Maybe you can show us, just demonstrate kidogo. What happens first as we go deeper and deeper to this topic? What, for example, a baby convulses, what are you supposed to do as a mom or as a parent?
The best thing you need to do is to just make sure that this child is not able to choke on maybe the saliva that is being produced or anything like that. Okay? So you do not panic. You get to the child. Okay? So for example, if this is our child, and this child is, suddenly like convulsing, okay? Like that, okay? So this is your convulsing child. So you just need to make sure that you put the child on the side. Okay, because remember, we have what we call the airway, the breathing and the circulation. Okay, so for the airway, you just need to put the baby on the side. When you put the baby on the side, what are you preventing? You're making sure that the tongue doesn't fall back. The tongue. Because remember, when you are unconscious, because it's a sort of a semi-unconscious state, that means the brain cannot control anything.
Okay, even the tongue.
Even the tongue. So the tongue, it's like a muscle. Because it has no nerve stimulation, it will just become limp or semi-paralyzed for a few seconds. So it will drop back. So if it drops back, it has a risk for your airway to be blocked. So you can't breathe. Whatever breathing the child is minimally doing, even that will be a problem. And that's not good because you don't get oxygen into the brain. So the best thing as a parent is do not panic. Put the baby on the side. That will allow the tongue not to fall back into the throat. Okay? You don't put anything in the teeth or to hold the teeth or anything like that. For example, a belt or a stick. Please don't do that. The teeth will be clenched very tight, okay? Because the child cannot control that, okay? It's like the muscles get contracted. So you do not want to put anything in there. Don't put water in there or any liquids or anything like that. Are we together?
Yes.
So that is now protecting your airway.
Okay.
Okay. In the hospital setups, we usually, because of breathing, because the child is not getting that much oxygen, we usually put a mask with oxygen so that whatever the child can breathe, it is rich in 100% oxygen. Okay. Yeah. And then we look at the time. Now this is a very important thing. You need to look at the time. If it's okay, the first one you'll be very panicked, so you may really know what is going on, and you may just be in a panic rushing and everything like that. But this is something you can actually manage at home. Because if you're looking at the time and it's like 2 minutes and the convulsion stops, that's an important message for me as a pediatrician of how the occurrence was, what was the situation like, what did the child do, were they shaking their legs or were they just stiff? So that's a difference. Being stiff and shaking is a different thing as well.
So those are some of the things that you look into when a parent comes to the hospital.
Yes, how long was it? That's the first question we usually ask. And was the child ill? Were they having a fever during that time? Okay. So of course now if it's a fever, you want to control that fever, but you cannot give Panadol because the mouth is clenched. But he may be recording a temperature of 40. So how do you? Because fever is now causing that convulsion. So you may want to try and reduce that fever. So what are some of the modalities you can use? So the first thing is to undress the child, okay? Making sure that you're covering for modesty, you cover the private areas, but you make sure you undress completely, okay? Try and sponge the child with some warm water, okay? Lukewarm, okay? So that you're trying to get the fever out, all right? And I'll explain why lukewarm, okay? So that's one way. The other way you can do is use Panadol, which is suppository.
Okay.
Because remember, you can't go through the mouth, so you may even use the backside and put the Panadol. That way you're trying to control the fever as quickly as possible. And that may even result in the convulsion stopping on its
Okay.
own. Okay? So that's the way to go about convulsion. Now, if it passes more than 5 minutes and you've done what you could do, but it's still, or it stops and then starts again, you may want to rush to the nearest healthcare facility so that they can now intervene with more things like medication, oxygen, you know, and maybe something to stop the convulsion medically. Yeah. Okay?
Yes.
Yes.
And how often do you get these cases, like people visiting to the hospital because of convulsions?
So febrile convulsions we do get quite a lot. I would say like in a week you'd see about 7 or 8 cases. Okay. Yeah. So, but then the ones who are already on an anticonvulsant or an anti-seizure medication, they usually do come on their regular follow-ups in the neurology clinic. But at times they may even come to the emergency room and you're told, no, he's on this sort of medication, but he's had too many this month. So then we then need to look back and try and do maybe another EEG and see, are we really treating this thing? Is there something wrong?
Yeah.
You know, and really look at our baselines and start from basics and then take it to a point where he's or she is sorted out. Yeah.
And when you started this conversation about convulsion, you mentioned when a baby convulses, this is something unaweza kuwa able kufanya at home as a parent.
That's right, yeah.
So what happens, for example, a baby convulses and they fall and you see like they've hurt their maybe head or they're just bleeding or amejiumiza. Is it good as a parent after the convulsion, after the baby is okay, do you need to go and get checked again?
Absolutely, because they're prone to drowning. Let's say they're swimming and they have convulsion disorder. They could convulse even in the swimming pool. So they're at risk of drowning, they're at risk of falling. Okay, so you need to be very cautious about their medication timings, making sure that but if they do have that incident, you need to make sure that they haven't had any other injury to the brain or the head after that incident. And it has happened before, yes. They have fallen down, they've hurt their face or their head, you know. Yeah, so you just want to make sure that is okay.
Okay. And what's with fever? You know, because Chef, usicheke. You know, many times unapata tu mtu anasema mtoto akiwa mgonjwa sijui nini akona fever. Mtoto akiwa mgonjwa sijui wapi fever. Now we are talking about convulsions and most of them zinakuja na fever. So I don't know, sijui fever. Daktari, tusaidie.
It's puzzling sometimes, and we also don't, we cannot explain why some children are more prone to convulsions, others are not, you know. So a parent whose child is having fever-related convulsions, to be able to know how to check temperature correctly. Okay, and in our previous sessions we've talked about fever and how to check it. Okay, so the best forms is to have a rectal thermometer or an ear thermometer, yeah, to give you precise temperatures. So it would be a good investment for those who are prone. And then also know what is normal temperature, right? So normal temperature is what?
36, 37?
Which one?
37.
36.
Oh,
so
it's 36.
So it's usually a range, right? It's not one specific temperature. So what I usually say, it's usually 37 degrees plus or minus 0.5.
Okay.
So 36.5 to 37.5. That's what we all live within. Anything above or below is, so above is high fever, below is hypothermia.
Yeah.
So when you're having high temperature and this child is prone to convulsions, you may want to know, okay, you know, monitor them, or if they're having an illness, monitor them more frequently, check their temperatures. And if they're going to, let's say, 38, you may want to undress them. You may want to sponge them very quickly. You may want to give them the paracetamol, which works faster when you give it, you know, as a suppository, than, you know, giving that, because that may take longer. Yeah. And a lot of parents decide, okay, the panic thing. If you panic, child's temperature, you rush into the car and you straight off dash to the hospital. But with our Kenyan traffic, you're going to have this temperature not having been controlled, you've not done any first aid, it's now going from 38 to 40, then your child convulses in a car and you're in traffic, how is that going to be? Imagine that situation. That's something really scary. Okay, so at home, try and do whatever you can at home. Try and control that temperature, put the baby on the side, right, where you say that if it's convulsing, you want to make sure that the head doesn't, the tongue doesn't fall back into the throat. Okay, undress, sponge quickly. Okay, you can put paracetamol if the temperature is too high, and we've talked about how to. Okay, and that should actually control temperature. Now, what information is really important are two. I'll just reiterate them. One is making sure you check the time. Okay. Because you're able to tell if the convulsion was more than 5 minutes, more than 10 minutes, more than 15 minutes. That tells us a different picture all the time. If it's a child who is having subtle convulsions, like just this, once in a while, or they're just jerking, you know, and then they're normal. You want to know what was that? That's not normal behavior, that's abnormal behavior. We are in the technological times. Take a video. Take a video, because you may come to the hospital and say he convulsed, but we need to know as a pediatrician, what actually was that event or that sentinel event or that incident? What did it look like? And that video is proof. Even to a neurologist, they'll want to know what kind of behavior, which limb was affected. Okay, was it both limbs, was it one limb? We call this focal or generalized, when all limbs are, you know, at play. So that tells us a big picture. So use the technology of at home, don't panic, take a video, do the first aid, whatever you can do. Okay, don't hold the child, let them convulse as it is, check the time. If it's lasting more than 5 to 10 minutes, you may need to take them to a healthcare facility, because now this is getting out of hand and it's not stopping on its own.
And I'm also thinking maybe it's good to maybe the parents to keep check. For example, because venye umesema inaweza happen hata mtoto akiwa kwa swimming pool. What if it happens at night when you're sleeping? Because I'm trying to imagine hakuna sauti inatoka, it's just the convulsions and all that. What would you tell parents about that?
That's a tricky situation, because you know, as a parent, you don't also want to be, your life should be normal. You should be living normally. You shouldn't be just stressed out, panicking, worried that anything can happen. But of course, you need to be cautious. Okay, so you need to talk to your neurologist very clearly. Like, if it's fever related, then you know, okay, my child is ill, I'll be monitoring fevers more better. But if it's a child who has convulsions, and let's say the medication went out of stock and you can't get that medication, you have to talk to your neurologist and see, what can I do? Is there an alternative medication so that I can be able to continue controlling those? So what you're basically doing is, when you're taking the medication, you're lowering the threshold for you to convulse. And that's the goal about it, you see. But if you miss medications, then you're bound to have those convulsions. So you wouldn't want to live and keep one eye open and one eye closed. You want to be comfortable. So it's something you should discuss with your pediatrician and say, what can I do? Because you know, you want to live a normal life. You want your children to grow up well without having any convulsion. You stick to your medication, stick to knowing what is actually the cause of it. Treating the cause rather than the convulsion would be a better way of living. You see, when you are in control of the seizure, not the seizure in control of you. You see? Yes. So that's what I would give as a home message, is to really dig deeper and find out what can you do to prevent any more convulsions.
Formative.
Very.
Nimelan
a couple of things. First things first, and I think this is even very important to any mom out there. You need to have a thermometer at home and train your nanny how to...
Two thermometers. One breaks down.
The other one should work.
I think we should have a sticker hapa kwa show. Do not panic. Do not panic. So, it's true, because at the end of the day, I think kitu main sana yenye who lead to things that should not have happened ni panic. Because kitu iki happen, as a parent, una panic. So guys, that has been practical mom lessons, and coming up next is mom story of the day. So don't go away.